Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter. Welcome to Conversations with E. I'm Esther, founder and CEO of Mind Myself. And again, it is my great pleasure to welcome Dr. Vicky to the show.
Thank you so much, Esther. Glad to be here.
Fantastic. Tell us a little bit about who you are and what you've done throughout your career, Dr. Vicky, just to set the stage.
I'm a retired wellness doc, board certified OB-GYN, even though over the course of my practice, I morphed to taking care of men as well as women because wellness is not just for women and it needs to be for all. And I brought in complementary alternative medicine, regenerative medicine, and energy medicine to my practice so that I could be the one-stop shop for my patients, that they could get everything in my office or I knew where else to send them.
I so appreciate that because having both the Western medicine perspective and complementary is just so useful. One doesn't have it all. It's so
Correct.
great. So thank you for doing that. And I know that you talk a lot about the 4 legs of the hormone chair, and we're just going to be talking about one of those today. But can you give us a little background on the 4 legs?
Absolutely. You know, when we think of a chair, you think of you have 4 legs to that chair. Well, in the world of health, and especially in wellness, realize those 4 legs are the 4 main hormone groups that support the foundation of your health. So it's your female male hormone, for the guys, just male, thyroid, your adrenal, which is your stress hormone, who's got stress, and your insulin. I didn't say blood sugar, I didn't say A1C, but insulin. So those 4 hormone groups not only have to be good and optimal, but they have to be in balance with each other. Or you're sitting on a chair with 1 leg, 2 leg, 3, maybe all 4 legs broken, which land you on the floor. Not a good place to be.
No, we don't want to be crashing to the floor for sure. This is part 2 of the sex hormones for women. And I know you're going to talk about men as well in here because that's always part of the discussion. But part 2 particularly is about menopause and post-menopause and why are these hormones so important during that time of our life?
Well, realize, and again, we talked about this last time, that the research that I did shows that there is age-appropriate bell curve levels of female hormone that women go through. And the woman who is, quote unquote, you know, the typical female is going to have a sawtooth increase up, and then it's going to be smooth sailing 30s, and then 40s, it's going to be a very up and down, way down. We have hormone in our body made by our ovaries from age 12, puberty, to age 50 and a half. That's a bell curve distribution if you average it during that time frame. But I want to impress upon people that once you hit menopause, that's your body's natural time clock saying the ovaries are no longer going to be functional. Well, I also want to let you know that 100 years ago, we only lived to 48 years old. We hit menopause and we died. So there was no such entity as menopause, which is hard to fathom if you think about it, right? We've had so many other breakthroughs in medicine that have allowed us to increase our longevity, but our ovaries are still part of how our body works. They still shut down approximately age 50. Some women before with premature menopause as early as 35. Some women don't have menopause until 58 to 60 years old, but that average age is age 50. So when we lose that hormone, we may actually live another 20, 30, 40 years, perhaps even another 50 years. So we carry hormone in our body. It's our lifeblood. It's what gives us our moxie. From 12 to 50, that's 38 years with hormone. We then are told it's bad for you after that. How can it be our moxie and then it's a demon? We're the same body. We're still women. Why is it so bad for us? And that's what we're told, is it causes cancer and heart attack and stroke. Well, I'm here to tell you the research proves that statement false. That is a myth. And the truth is that the true research, when you look at bioidentical hormone replacement in a woman whose ovary stops working in menopause, you're really going to zero production when you had hormone for 38 years. Well, do you think your body is going to tell you? It sure is, from head to toe. You're going to start losing hair and thinning your hair. You're going to get dry skin. You're going to get changes in your vision. You're going to get insomnia, short-term memory loss, poor memory and forgetfulness. You're going to get migraines, muscle aches, joint aches. Just take and go every organ system head to toe, because every organ system is yelling at you, where's my hormone? And you don't have an answer for it because A, nobody is checking you. B, you just know you might have a hot flash or a night sweat, and oh, your doctor may say, I guess this means menopause. Good for you. And you go, wait a minute, I feel terrible. I want to know what I can do to get through this time. Well, it's not just getting through this time. Okay, that's just taking, instead of being up here with hormone, you're now down here with hormone. And how do you bridge that gap and bring yourself down there? Well, that's a temporary get yourself down to nothing. Where my statement is, for your future health and prevention of breast cancer, heart attack, stroke, osteoporosis, and Alzheimer's, you need female hormone in your system. So what is the research? Well, the research is American research versus European research. And you would think they were on the same page. Oh, no, 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 no. The Women's Health Initiative American research looked at Premarin and Prempro. Now, neither of those are human-based. Premarin is pregnant mare's urine. Horse pee? Yep. Prempro is Premarin with a synthetic medroxyprogesterone acetate chemical. So horse and chemical? No, thank you. We are neither. We are human-based, bioidentical. That's what the European research looked at. So the European research said, we see no increase in breast cancer. We, in fact, see no change. We see a decrease in heart attack, decrease in stroke, increase in longevity. Whereas the American research with Premarin and Prempro said, oh, no, no, no. We see an increase in breast cancer, increase in heart attack, increase in stroke. Those are 180 from each other in results. So patients would say to me, which one do I believe? Well, believe what your body gave you. Believe in the human-based bioidentical research, because that's what your body saw. So that's what your body wants back. So whether your ovaries kick back in because it was premature menopause, or whether we replace it for you, realize that's what your body worked off of for 38 years and should continue to work off of.
This is so important. And what is the source of bioidentical hormones? And we've heard about horse pee for Premarin and associated products. Where do bioidentical hormones come from?
Estradiol is primarily soy-based. So many people would say, can't I just eat soy and get what I need? Well, you're not going to get good pure soy. That just isn't going to happen. And there's not going to be adequate conversion to actually make the estradiol levels that you're looking for. The progesterone is actually coming from sweet potatoes, from yams. And so it is mixed many times in a form that is, it has to be oil-based in order to get that progesterone able to be taken up by your body. And so many times in a pharmaceutical world or a natural world, it will be put into some sort of an oil base. Many times pharmaceutically, it's a peanut oil. So you have to know, if you have a peanut allergy, that you do not take that form of progesterone, that you would need it compounded for you in a different, perhaps an extra virgin olive oil, that no peanut is in that formulation.
And so somebody just saying, because the question came to me actually a couple of weeks ago, which I think is fascinating since we're discussing all of this right now. So topical. Someone said, well, should I just be adding these other things like yams and soy and maca and some other natural things, black walnut, etc.? How would you proceed? So what I'm hearing is really you need to talk to a practitioner to know what your actual levels are, and then to do the right things around those so you can be monitored. It's not just something you should just go out and start taking a supplement. Is that correct or not?
That's correct, because what most women don't know, and medicine doesn't know, is how are you absorbing that soy? If your progesterone is off and you have a slow GI tract, you aren't absorbing anything well. So putting something in that you now want to absorb, you don't even know whether you're absorbing it or not. That's where monitoring it with your doctor, with your healthcare professional, is highly important. Even if you say, well, I eat yams every day, you have to have about a truckload every day to get enough to make the progesterone that your body needs. And I don't think anybody really wants to do that.
Well, you get pretty fat if you eat a truckload of yams every day.
Well, it doesn't give you a lot of variety in your diet.
No. And what if somebody, like for myself, I can share just my own journey. When I hit 50, I stopped having my periods, and I had some very mild warm flashes, and that's about it. I didn't have any of those other raging symptoms that so many women seem to share about and are so real and uncomfortable and sometimes despairing is what I hear from women. I didn't have any of those, but I know that my hormones have not been balanced, and I'm still in that place of looking at that. What advice do you have for somebody like me?
Even if you feel you have weathered that storm well, that ship has sailed and I feel great, the symptoms that I would see women coming in 5 years, 10 years, 15, 20 years, they were slightly different, but they all had the same theme. It was what you used to have has slowly been taken away from you. Your muscular strength, your joint health, your teeth. I cannot tell you how many 70-year-olds would tell me, I did menopause great, but now I'm facing a $40,000 dental bill because all my teeth are rotten. They don't know why. And I have to have every tooth in my mouth pulled and implants made. And so I don't know where I'm going to come up with $40,000, or they have to bridge it first so they can raise the money to then do the implants. But that's calcium loss from your teeth. What most women are never told is that you have to have an estradiol level of 30 by blood test, 30, in order to take any calcium from your diet or supplement and absorb it. So guess what? You can take a calcium supplement every day. Unless you know your level of estradiol is 30 or more, it goes right on through. You never see it. So where does your body get its calcium if it isn't absorbing what you're taking? It goes to the bone bank and the teeth bank, and it pulls calcium from your bones and your teeth. So you do that for 20 years, 25 years, and guess what? You're going to be seeing the orthodontist and getting all new teeth. Or you're going to take a step off the curb and fracture your pelvis. things that shouldn't cause a bone break will cause bone breaks, and they're not comfortable to go through.
Absolutely not. You've mentioned the research and that the US research is very different than the European research. What are some of the myths that people have heard about bioidentical hormone therapy? And we'll talk a little bit more about what that actually means later again. But what are some of the myths?
One of the biggest myths is, again, the whole breast cancer myth. Women are terrified that if they touch hormone, that they are at risk for breast cancer, and nothing could be further from the truth. What most women are never told is that when you stop making hormone on your own, your ovaries stop working, then you continue making testosterone, number one, so you become more male than female in your menopausal years. What? Right? So what does male pattern weight gain look like? Right on your belly. And most menopausal women will say, I've put on 5 pounds, I put on 8 pounds, I put on 15 pounds. I cannot get rid of it. I do the same things that I did before, and I can't lose that weight. Well, the second dirty little secret is that besides the weight gain, that belly fat makes a form of estrogen called estrone, E-S-T-R-O-N-E, estrone. Estrone converts some of that to estradiol. Now you have estradiol, no progesterone. You are hyperstimulating breast, abnormal mammogram, breast cancer 15, 20 years down the road. Totally preventable, but nobody warned you. Nobody told you your own body is making estradiol from your body fat. What is wrong with this picture, right? And they'll tell you, well, don't worry, menopausal breast cancer is easier to treat. You usually won't get a recurrence. Well, who wants it in the first place? That is not a comforting thought, is, oh, I'll get over it better. They're still going to offer you chemo and radiation and surgery, and who wants any of that? Wouldn't you rather be pre-warned and therefore you are pre-armed with what you can do to prevent this from happening to you?
And be proactive in the first place. Right. So what do you recommend for women on this journey to start paying attention to? I know you have said it's never too early to start getting your hormones tested, even as an adolescent. So then you have some tracking data over the course of your life. So get your hormones tested, those 4 that you're talking about in this case, but also the other 3 that you mentioned, thyroid, insulin, and cortisol. Ooh, I'm learning. This is good. So paying attention to those, I know you've got some books. How do you approach your doctor to start this process and go, okay, I want to be proactive. I don't want to wait till I'm in menopause. I don't want to wait till I'm experiencing symptoms.
That's exactly right. So the first book is Blossoming, and Blossoming is the adolescent book. It is written as a mother-daughter guide. We dismiss our teenage daughters because we just call them drama queens, but their hormone is just starting up and is irregular in a mirror image to what their mom is going through. And we talk about in full bloom, which is perimenopause, menopause, and beyond. So again, that bell curve that I talked about and how hormone will have a bell curve look, it's going to have that sawtooth up and down. Up in adolescence, it'll peak and then have its sawtooth drop down. So that is illustrated in the books. It is also at the end of the books, there is that section, how to talk to your doctor. So realize most of the time you walk into the doctor's office, your expectation of being helped is different than what the doctor's expectation is. So you only get 2.5 minutes, maybe 5, if you're really lucky, to talk to this healthcare provider. But what usually happens is you get tongue-tied because you can't get everything out that you want to get out in perhaps the priority that you want to state it with. So in the both books that I'll show you as a single page, there is an ability to have these symptoms that could be happening to you as a hormone symptoms worksheet. You can download this. And again, Esther, this can be something you have on your website.
We
for
do
download.
already. We do
Perfect.
already. So it's under one of our blogs, Hormone
Perfect.
Symptom Worksheet.
Because you can do this ahead of time. And if you have 5 symptoms that you want to make sure you don't miss telling your doctor, you've already got it. And if you have this in writing to hand to your doctor, they cannot dismiss or forget what you said because you've handed it to them. And so you are now on record as these are the things I need to address. Can you help me with these? They may say no, they don't know how to start addressing these. But then you say to them, but I know, I've got this book that tells me the blood work that I need. So will you help me draw this blood work so I can actually address these symptoms? And you actually may be teaching your doctor how to help your health.
I love it. And I would encourage anybody listening to this, if your doctor is not open and receptive, it might be time to look for another opinion. Not saying ditch your doctor necessarily. They might have other great information for you, but maybe get another opinion or find somebody else who can take you to the next level. Now, Dr. Vicki, I know that we're coming to the end of this conversation for this particular topic, but I've heard that it's not safe to take these bioidentical hormones or just hormone replacement therapy for long. What's your comment about that? How long can you be on these? What's your thought?
Forever. I started women in their 70s and 80s. And here's a story I'll tell you is one of my 85-year-old patients who wintered in Florida for 6 months, came back to Wisconsin for the summer for 6 months, called from Florida, and she said, I just need to let you know that I had a fall and I was taking the riding lawnmower. It was on a hill. It toppled over on me. Now, 85 years old, and she's 4'10" and about 90 pounds soaking wet, right? You would expect she would have broken something with that. She said, well, I got off the tractor, I got it back onto solid ground, and I started recutting the grass. Is there anything I should be worried about?
Go, girl.
Bingo, right? What is wrong with that? And another story of an 82-year-old woman that I sent her for her mammogram, and the doctor sent over 3 days in a row that they wanted to do follow-up compression view and ultrasound and biopsy. And I kept writing back no and sending it by fax back. So the 3rd day, the doctor calls my office and says, why won't you let us take care of your patient? And I said, because you are looking at on a mammogram what you think is a 52-year-old woman, and she's 82 on hormone. And she goes, what? You have an 82-year-old on hormone? Are you out of your mind? And I said, listen to the rest of my story. I said, she is an 82-year-old who feels and looks 52. You, on the other hand, see a mammogram with an age that is discrepant from what you expect to see, and you already anticipate pathology. I said, I will not let you put the C word branded on her forehead. I said, you don't know her, you will never see her again, and I will deal with the fear that you have instilled in her for the rest of her life, that there's cancer there that we haven't picked up. I said, I will let you do a compression. I will even let you do an ultrasound. I said, but if you dare think you're going to put a needle in her breast before you talk to me, I said, think again. I said, I do not give you permission to put a needle in her. So she said, okay, fine, I'll do all those other things. So I got the reports on the ultrasound, on the compression. No further testing needed.
Excellent. So there is hope for the rest of our life. There are other alternative therapies and available technologies now that can also help with that, but that's a whole other conversation on another day.
Right. Well, and I want to impress, there's one other book that I think everyone needs to be aware of, is how to reverse Alzheimer's, prevent and reverse. And guess what they
Did you
state?
write that?
Nope, this is a neurologist. Think about the fact that this neurologist at UCLA
Dale
wrote this.
E. Bredesen, MD.
Dale Bredesen.
Bredesen, thank you.
The End of Alzheimer's. And he was enlightened enough to say how important balancing all 4 hormone groups are to the prevention and reversal of Alzheimer's.
This is such an important conversation we've had, Vicki. What would you like to, Dr. Vicki, what would you like to leave our audience with today?
Is 80 is the new 50. 70 is the new 40. Feel 15, 20, 25 years younger than your chronological age and allow your body to be as healthy as you want it to be. Take charge. Empower yourself to know how your body works.
I love it. Thank you so much for being here, for your wisdom, for your experience, for your expertise, and your compassion. Thank you.
My pleasure.
Thank you for being with us at the Mind Myself podcast today. We know that time is precious and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guests directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.